Hi, I'm Dr. Crowley here at Empire Medical Training in Fort Lauderdale. I'm the Director of Aesthetic, and I'm thrilled to be here to share some procedures with you guys today. We have been doing an entire day of filming, and it's really been quite fun. This afternoon we are going to film a procedure using Hyper-dilute Radiesse, which is a calcium hydroxyapatite product that we're going to use for cellulite treatment. We can use Radiesse in a variety of fashions. We can use it just as on label in the package as a filler, or we can dilute this and use it in different areas of the body to provide biostimulation. So what we're going to do is demonstrate a procedure for you guys where we are going to treat cellulite. The patient that we have here as a model today is a beautiful young female patient with very little problems, so really doesn't have much cellulite at all. So she will respond great to this treatment. We find that patients who are under 35 to 40 years of age usually respond well to one treatment with this as a biostimulant to help with collagen improvement. Our older patients are patients who may be younger but smoke or have a poor diet. They may need a subsequent follow-up treatment. So hopefully today this will be enough and our patient will have a great result. This patient does not have very much cellulite to start with, but she does have a few areas of concern that she would like us to address. When we're using our biostimulant fillers today, calcium hydroxyapatite, or Radiesse, it's important that we assess our patients standing or in the upright position before we have them lie prone, or if we're working on another body part supine, perhaps for the procedure. These positions will change some of the landmarks and change some of the actual areas that we're wanting to treat. So with this particular patient, as you see with her standing, the one particular area that bothers her a lot is this divot that we see right here. So hopefully it's showing up great for you guys to see on your cameras or on your videos. But there is a pretty prominent area here that's a bigger divot than some of the areas of cellulite that we see on the posterior thigh throughout. So I will mark that before we get started with this treatment. So once she lies prone on the treatment table, that I won't lose this area, that I know that I need to focus more treatment than the remainder of the area. Some of these finer lines of cellulite throughout here, we're just going to spread a nice even layer of our product throughout, so I don't need to mark each one of those. If you had a patient that had numerous larger divots or holes, you would go ahead and mark those at this point for our cellulite treatment. The importance of marking these areas is that we're going to use our product in a little bit more concentrated fashion as we treat that particular area compared to the hyper-dilute fashion that we're going to treat the rest of the cellulite with. In some patients with a more pronounced or severe dip, we could actually go in with undiluted product and put that in there, so some Radiesse just straight out of the vial or out of the syringe, and put a little bit of filler in that area. In this case, it's not that severe. I'm going to use a dilute fashion, so I'm going to put that, when we talk about dilute Radiesse, that's a 1-to-1 ratio. And I'm going to go over with you guys how we can do this from using just one vial of Radiesse. Now, ideally in my practice, we would do one vial of Radiesse in a hyper-dilute fashion for each posterior thigh for a cellulite treatment. So today I'm going to go over how we can take a portion of that if you have one area that you want to make a little more concentrated, and prepare that syringe and then use the remainder of your Radiesse in a different dilution for your cellulite treatment. This is a demonstration of how we can use one syringe to make different dilutions. So in our patient, you're going to see we have one particular area of concern that I want to use a slightly more concentrated product. We're going to make it a 1-to-1 dilution for that particular area. So I'm going to use 1/2 or 0.5 mLs of my Radiesse. So in my 3 cc syringe, I've also put 0.5 mLs of normal saline. I'm going to now transfer 0.5 mLs of my Radiesse into that syringe. I'm going to remove my Radiesse and attach an empty 3 cc syringe, and now we're going to thoroughly mix those two. So I will end up with 1 cc of product that is a 1-to-1 dilution. Again, remember that the more dilute our radius is, the quicker the product will separate, and we will need to continue this mixing process if we let the product sit too long. Now this is ready to administer in an area that we will demonstrate this marked soon. For the remaining product, we have 1 ml of our Radiesse undiluted remaining, and I'm going to do a 3-to-1 dilution for this, for collagen stimulating and cellulite treatment. So there's 1 ml of Radiesse, 3 ml of our normal saline. I'm now going to transfer the Radiesse into that syringe. I'm going to remove my Radiesse syringe, place another 10 cc syringe, and now I can make this a nice homogeneous mixture. Remember, we want at least 10 passes between the 2 syringes or more, just to ensure that you have no clumps of product. This preparation is a 1-to-3 dilution, so 1 part Radiesse plus 3 parts saline. Our other solution is a 1-to-1 mixture. This solution that is more dilute, or a 1-to-3 dilution, will separate much more quickly than my other product that's a little bit thicker and is a 1-to-1 dilution. Now that I have both products ready, we can get our patient in position and cleansed, and then we'll perform the treatment. We're going to be doing this today with a 22 gauge 2-inch cannula. So as you guys can see, it's very difficult to see any divot now, and actually we don't see very much cellulite at all with the patient in this position. It looks like there's not even an issue to address. That's why it's important to make these assessments with your patient in the upright position. For this area that we're going to use a more concentrated product, I'm going to go ahead and make a small injection of my local anesthetic. So this is 2% lidocaine with 1 in 100,000 epinephrine. We're going to make a small wheel here. That is going to be our insertion site for our cannula. Now for the remainder of the treatment, we just want to spread a thin layer of our product out across the area just diffusely. So what I'll do for that is I'm going to make several insertion points here. Okay, big stick, 1, 2, 3. And these are going to be for me just to spread my cannula out. So we're going to do that, and I'm going to do one more injection site right here, 1, 2, 3. And from this, we'll be able to cover the majority of the surface area that we need to with minimal number of injection sites. Just putting a little bit more back in that first one, okay? With any of our biostimulant products, we want to be certain that we're using aseptic technique. You'll hear us mention that over and over again. And for this area, also we'll do the same technique. So primarily the problem was up in the higher portion. And so with a 2-inch cannula, we can gain access to those sites with 2 to 3 injection sites. So we're going to go 1, 2, 3. And this is usually, okay, here we go, 1, 2, 3. The worst part for the patient is the local anesthesia. The rest of it's a fairly comfortable procedure for the patient. And last one, 1, 2, 3. Okay, great. We're using a 22 gauge 2-inch cannula for this procedure. So I have a 21 gauge pilot needle that came with this cannula kit. Okay. We're going to make an insertion point, 1, 2, 3. Since we use lidocaine with epi, we should have very little bleeding at the injection site. Okay. What you'll notice I do first is I'm actually going and I'm feeling for any fibers that you may fill with cellulite, and you break those up. So this is just like a little undermining technique. And I fill a few fibers, and they're not very much. But any kind of fibers that we fill, I like to kind of break that up or undermine that first. And we're just going to do little retrograde lines of our product. See, we're using a fanning technique. Are you doing okay?
Mm-hmm.
Okay. Okay, there. That's it. We're going to switch now to our more diluted formula. Remember, it's a 3-to-1 dilution. Okay, and again, now we're using our more diluted formula. And so in this case, we have a 1-to-3 dilution of Radiesse to saline. And if we have any sort of fibers, we do have to break that up again, just like we did before. So we just want really, really small aliquots of our product as we break up the fibers and just put small aliquots down to stimulate collagen. Now, there's several ways that we can do this, and this is just one of the many ways. We can do things like carboxy therapy or PDO threads, or a combination of carboxy and PDO threads. Like I said, there's a number of ways. The key is to break up the fibers and stimulate collagen in this area to prevent that from tethering back down as it heals. We'll see the optimal results from this procedure in approximately 2 to 3 months. So this is not a quick fix. It's not something that your patients are going to see the result of immediately, but something that they're going to see over a number of months. So it's very important then to have good before and after pictures so you can compare, because they'll tend to forget kind of where they started their process as time goes by. And I find that's true with a lot of our biostimulants. And so not just with body treatments, but really for any of the treatments that we do, for even if we're getting them on a good skincare regimen at home or Retin-A or something like that, it's important for us to do the photos so we can look back at those photos, you know, a year later, 6 months later, and see the progress that we've made. And you guys will see, I think, one of your facial aesthetics course, and we actually review it in a number of the Empire courses, but we do review with you the proper way for taking before and after photos so that we're comparing patients in the same light, the same angle, and definitely that's not always as easy as it seems, because sometimes we get selfies or photos from patients that, you know, we can't control all those factors, but we do go over the proper way of taking these photos in your class so you can get good before and after pictures for your documentation, and also if your patients allow you to use it, then for any of your Instagram or social media where you want to show the results of your treatment. This is an area also that we can combine this, use a combination therapy. So we could do this along with PRP, with PDO threads. So all those are collagen stimulating treatments. So that pretty much takes care of the treatment for this side. We'll go ahead and do the same thing on her contralateral leg and see the patient in 2 to 3 months.